So, as part of the person-centered approach, the aim as a therapist is to stay with the client, offer the core conditions, and rather than making judgments or categorizing them, you're staying with their process as closely as you possibly can. Today, we're going to talk about a concept called fragile process, which is a pattern that as a therapist or as a trainee therapist on placement, you may see sometimes in clients. I'm familiar with fragile process from this book here. This is the book I talked about in the previous video, if you're doing this in order. Person-Centered Therapy Today, New Frontiers in Theory and Practice by Brian Thorne and Dave Mearns. And this is a chapter in that book by Margaret Warner. I don't know why that's an A. Onto her name, that should be an M. Now it's an M. So, fragile process, as she says, is a style of process in which clients have difficulty modulating the intensity of core experiences, beginning or ending emotional reactions when socially expected, or taking the points of view of other people without breaking contact with their own inner experience. Clients in the middle of a fragile process often feel particularly high levels of shame and self-criticism about their experience. And there's another quote here. In relation to the therapist. Therapist comments to explain the situation or disagree with the client will be felt as attempts by the therapist to annihilate their experience. So like I say, with person-centered therapy, you're in their process, you're with the client, you're being with them, you don't fix them or judge them or categorize their experience or make sense of it in any way that's separate from their own process. I suppose that the extent to which you do this is a matter of degree, maybe. Maybe with some clients whose process isn't fragile, you could maybe be a bit looser with describing things that, are slightly different from how they've described things. You may use slightly different words. It's all a matter of degree, I suppose. With people whose process is fragile, there needs to be a bit more of an effort to make sure you're really not stepping away from exactly how they are seeing things and exactly how they are experiencing things. Warner used the example of if somebody expresses irritation and says they're irritated and use the word angry, that may well have different connotations, and somebody whose process is really quite fragile might see that as quite an imposition, whereas maybe some other clients wouldn't. This might be quite a strange analogy to use, but if we think in terms of numbers, if a client, for example, is saying 3 and the therapist says 3 back and they're meeting each other, or if they are 3 and you're with them in that 3-ness, maybe with some clients, if they say 3.297 and the therapist may round it up, they may say 3.3, and some clients would find that helpful. It's maybe not entirely accurate, they've moved it a little bit actually, that therapist, but some clients may well be fine with that. They may well not see the difference as being particularly important. With clients whose process is fragile, it needs to be the exact number or as close as possible. You really need to be quite vigilant to stay as close as possible and not be flippant or loose with your use of language. So if where the clients are, if we go further with this, is represented as 2.978351, the therapist, as far as possible, is 2.978351 with them. That 1 at the end, if that becomes a 2, I mean, as a therapist you need to be doing this anyway. I think you should be, no matter how minor the detail, it's important to be as attentive as you possibly can to focus on exactly where they are. But yeah, when the process is fragile, I guess it's riskier to impose your own ideas on the session, and you need to be really careful when it comes to bringing in anything new other than what is precisely in their process already. And I think it's fair to say that with some clients you might not need to be as absolutely vigilant in the same way. Maybe if some clients express 2.978351, maybe turning it into something slightly different, some people might quite like that because you're bringing in your own idiosyncrasies, you're bringing in the fact that you are a different person who might use different language and different concepts to describe the same kind of terrain. Some people might quite like that. Others though, and this is what fragile process relates to, they need you to be with them. You cannot be relaxed about reconceptualizing what they're saying and using your own language, you, as far as possible, need to be right in there with them. And even just changing a word to another word might feel like you're, like it says here, annihilating their experience. Sorry for the long quotes here, but I think these do really capture the concept and the importance of working in a certain way with clients with fragile process. I'll read each of them out and have a chat about them. So, in a certain sense, clients in the middle of fragile process are asking if their way of experiencing themselves at that moment has a right to exist in the world. Any misnaming of the experience or suggestion that they look at the experience in a different way is experienced as an answer of no to that question. And I think these clients are often really well suited to person-centered therapy. Person-centered therapy, which is really about offering them a space where they receive the core conditions of genuineness, acceptance, and empathy, where things aren't brought in by the therapist to solve things. They're not directed. It's a space that they're in control of. And for someone with fragile process, it may well be a feeling of being in control that is the most crucial, because they may well not get that anywhere else. And if in other forms of therapy a therapist jumps in and says, right, we should do this, right, we should do that, they may well experience that as a negation, as a rejection of where they are right now. And what they need is a space to feel really heard and really accepted. And the person-centered therapist needs to be comfortable with the not knowing. It can be easy sometimes to zoom out and give them a broad brush kind of summary of the whole experience or whatever it is that they've been talking about. And I think it can be quite rejecting. It can feel rejecting to a client if they're in fragile process, because I don't know, zooming out sometimes and giving a big summary of a load of things can give the wrong impression. It can give the impression that things are neat and things are perfectly understood, when actually it's the detail. They want you to get with them in the detail of it and really be with them. This second quote, they may need to hear their moment-to-moment reactions reflected almost word for word in order to know that their therapist have grasped exactly what they were feeling and trying to express, that the therapist is really with them. It doesn't matter how many decimal places they go into. The therapist is with them as closely as they possibly can be. Sometimes therapists, especially when they start out, they feel as though a therapy session is good if a lot of ground has been covered. Oh, we talked about this and this and this and this and this and this. With some clients, you may well talk about one specific thing, and you really might talk about really what's going on inside of them on a microscopic level, and you might not cover that much ground, but you are with them at the microscopic level throughout, and that itself may well be the most powerful thing about the therapy for the client. Therapists need to be particularly attentive when clients have a sense of experiences for which they do not yet have words. If therapists make space for the lack of clarity, clients are likely to find their own words for the experience. For example, the therapist might say, something about that feels really uncomfortable, but you're not quite clear what it is. The client may then say, yeah, it's a kind of sadness, hopeless feeling. On the other hand, if the therapist fills in the meaning, the client is likely to feel misunderstood and angry or give up searching for the right words to express the experience. The therapist then needs to hold on to the uncertainty that they may be feeling and really be okay with the not knowing. This can be uncomfortable. It can feel as though you're really kind of walking through fog, because perhaps you don't really know what the wider meaning of the experience is. Maybe the client doesn't either, but therapists, I mean, the example I used about zooming out and giving a broad brush summary, or the idea that a therapy session is good if lots of ground has been covered and lots of topics. This relates more to the therapist's anxieties and the therapist's sense of satisfaction and maybe their need to understand things fully than it does to the client. Sometimes a good therapy session is being with the not knowing with a client and really just being with them step by step wherever they're going, maybe without knowing the bigger picture. As a therapist, maybe you don't need to know the bigger picture, and maybe Sometimes the therapist needs to understand exactly what's happening right now, or how everything fits together can get in the way of the client's process. You wrench them out of their process, which they're finding really difficult to explore. And putting things in some broad context, it can feel really flippant and quite rejecting of where they're at. And it's more about the therapist's comfort than it is about the client when people do that. And of course, with some clients, you can do those things. You can zoom out and give a summary of what you've heard so far and join the dots of what you've covered, and give some kind of cohesive picture of things. And maybe some clients will really benefit from that and really appreciate that. But some clients, you may well just need to stay with them because that might be what they don't get anywhere else.